We are going to wrap this up. And I first of all want to thank everybody here who contributed. I think it's really striking that at 4 o'clock and after 4 o'clock, we're still going with ideas, things we can do, things that can happen, how to make change in the real world. And they've been tremendous ideas and suggestions. And we have gotten them all down, and they will help us, and we will incorporate these into the report. The report will be a book. And there are really three ways that this gets out. One is through your hearing it and being here, and all of you go back into the world with the power to implement things and apply what you've learned. The second way is through those people who have watched the webcast, and I want to thank all of those who are still with us at this point in the webcast, and thank all those who will watch it in the future, because these interactions, the comments, will be accessible and available on the IOM website through the webcast. And third, they will go into a report, basically a book on this topic of violence and mental health, mental illness. And again, your comments, your input, your thoughts, your presentations, your papers will get out there, and I think will change the way people look at this. Your messages are strong. I think it will be a hard-hitting campaign. Peter, it will be a campaign that makes a difference. And I think we have the ammunition to do it and go out there and change. I want to ask you to fill out your evaluations on your desk in front of you. Please fill those out and leave them here. They take approximately 62 seconds, so we're not going to impose too much on your time. But if you do it before you leave, you'll do it. I want to end with a very brief story. This is a story about a very good friend of mine, one of my closest friends. He's also a member of the Institute of Medicine, and he was the editor or author of the best-selling ever report put out by the IOM, and it was about medical errors, and it was called "To Err is Human." And it talked about 100,000 people that are killed by doctors' errors every year. But he wrote a powerful, powerful book. And Don brought to the IOM a saying by Goethe. And this saying hits at a theme that so many of you brought up and touched upon. And what Goethe said is, willing is not enough, we must apply. Knowing is not enough, we must do. I'm going to read that again. Willing is not enough, we must apply. And knowing is not enough, we must do. This is a theme that I heard repeated from all of you over and over again. So Don found that Goethe quote, and he used it in his book, and it's become adopted by the Institute of Medicine. So now this very organization puts that in the front of all its publications, but it's your word that's going out there. But for Don, this wasn't enough. And he said, very much as Patrick said, that we really need to reach the people who do things. And so Don decided, how could he do something? How could he bring about changes? He was appointed by President Obama to be the administrator of Medicaid and Medicare. He had a budget of $1 trillion, but felt that he didn't really, in this political system, have the freedom to do. And he decided that the real doers are governors. They are the executives at the state level, and they can make these kind of changes. They can take this information and put it into practice. And Don is now running for governor. Get that, this healthcare improvement nerd member of the Institute of Medicine physician has the audacity, the nerve, and the courage to run for governor. So I urge you to follow that race, because he's going to carry the flag for all of us. He's carrying that flag, and I bet on Don. I bet he's going to win, spurred on by the Goethe phrase that willing is not enough, we must apply. Knowing is not enough, we've got to get out there and do. Well, you've given us a long list of things to do. I thank you for that. And I know this is my last session with this forum, but it's been a wonderful time. The session's been wonderful. The staff has been incredible, and my special thanks to the staff, Rachel, Kimberly, Audrey, Patrick. You've done a wonderful job, and I know that in 10 years or 20 years, I'll give you a little more time, all of you, I'm going to look back, and I'm going to look at this area of mental illness and violence, and you will have changed it. Your tertiary interventions, your primary care interventions, your work in China on suicide, your work on the impact on children, reforming the criminal justice system, it's going to have made a change. It's going to have made a change. And there will not be violence related to mental illness. We will have taken care of it, I'm convinced. And I end up with the last metaphor that goes back to the elephant in the room. And it's an African proverb. It's a question, how do you eat an elephant? How do you eat an elephant? And the answer is one bite at a time. You've given us so many bite-sized pieces. They're going to make a difference. This is an elephant that we can eat. I thank you all again. It's been a wonderful session. Thanks to the planning committee. You've done wonderful work. It's been very, very nice to be here with you and work with you, get to know you better. And I wish us all, as we go forth, to change the world. Good luck. Thanks, everybody.